Good afternoon, everybody. I would like to introduce the Mayor of Georges River, Kevin Green, to present our Keeping Georges River Safe community information session. Over to you, Mr. Mayor.
Thanks, Kath. It gives me great pleasure to, well, it doesn't actually give me great pleasure, but it's certainly an opportunity to welcome you here to our Keeping Georges River Safe, our community information session here this afternoon. I am Kevin Green, and I have the privilege of being the Mayor of Georges River Council. And the first thing I'd like to do is to acknowledge the traditional custodians of the land on which we work and live. We pay our respects to the Bidjigal people and their elders past, present, and those who have resided in these lands for over tens of thousands of years. Thank you for taking the time to log in for this webinar. We appreciate your commitment to our community. Yesterday, the local Emergency Operations Centre team for Georges River was activated, and this information session is the first of one of many opportunities to share their questions through Open Up a Q&A panel as part of this webinar. I want to acknowledge those who have already taken the time to think about what is affecting them and their community and share some of those questions with us. If you still have unanswered questions, you can add these in the chat section, and we will group them into themes and try and answer them all today. We would also like to take this opportunity to remind you that although we understand this is a distressing time, rude or inappropriate comments or behaviour will not be tolerated, and Council reserves the right to remove participants if this occurs. It now gives me great pleasure to introduce Toby Wilson, the Chief Executive Officer of the South East Area Sydney Local Health District, and Paul Callahan, Chief Inspector, St George Police Area Command. We thank both Toby and Paul for joining us today. And I'll now ask Toby to take us through some of the advice and what the Georges River community needs to know. Thank you very much, Toby.
Thank you, Mayor, and thanks for the opportunity to talk to the community today. I'd also like to start by acknowledging the traditional owners of the land on which we're meeting today and of where you're joining this broadcast from, and any Aboriginal people that are joining us today. If I maybe can kick off with just a little bit of an update on the situation in Georges River Council, because I know that's been a lot of the topic. As of today, we now have 106 cases within the LGA. Most of those cases have appeared in the last week or so, which is where most of this concern has occurred. If I can give you a little bit of a summary of where we're seeing the cases, generally the cases are occurring within family groups or for those within workplaces. So, and probably the most worrying component of that is we are seeing quite a significant amount of spread within family groups where generally young adults who are moving around the community for essential work or for other reasons are contracting the virus and then bringing it home and infecting grandparents and children and others, and therefore the cycle does continue. So it is concerning how we're seeing the spread and how we're seeing it escalating, and as a result, certainly government has seen fit to take the measures that are in place at the moment. If I can just call out a few components of that before I get into some of the details in more depth. First and foremost, I think the main reason that these restrictions are in place is to try and limit movement and try and restrict the amount of interaction that occurs between people. So we do believe the virus is circulating within the community. Certainly the evidence is that it is circulating within the community. So the best way to tackle that is to reduce the amount of interaction we have within the community. So limiting travel outside the household to what is truly essential is what is really important. Particularly for this LGA and the other LGAs that have been called out as the 8 LGAs of concern at the moment, mask use outside of the home is essential. So whenever you set foot outside of your house, you need to have a mask on at all times. So that is one of the best ways that we can stop the spread if you do have to step outside the house. So please, if people can attend to that, that would be great. We'll get into a little bit around testing and the location of testing clinics, but there are plenty of testing clinics. I guess one of the things I want to reassure people is that for a majority of clinics, if you present and get your test back, you will get your test result back within 24 hours. Our turnaround times are excellent, both in the public and the private clinics at the moment. And I know anecdotally, we hear one of the concerns why people don't want to get tested is they don't want to have to isolate while they're waiting for the result. Obviously, not getting tested and having the disease and passing it on to others is a significantly bigger threat to you and your loved ones. So I would strongly encourage people to get tested. We'll also talk a little bit more around vaccinations and where you can access the vaccinations within the local health district. There is a clinic at St George Hospital. I was speaking to the chief executive at the PHN, and he has informed me that around 2/3 of the GPs that currently have practices within Georges River Council currently have access to the vaccine, and the district is also looking at working with council to set up walk-in clinics in the next week or so, and we'll get more information out as soon as we've got locations around that. But we are working to try to make sure the vaccine is available as per ATAGI guidelines for anybody that would like to access it. And certainly in the current situation within the LGA, strong consideration of accessing AstraZeneca should be given by individuals. Maybe if I move on to some of the specific questions that people have come through and the specific themes that people wanted us to address. And maybe, as the Mayor said, if there were questions that you wanted to send through, please send them through on the chat and we'll try and pick them up as we talk. There's a lot of questions around who are authorised workers, and there's a list there, and also probably more importantly, there's a link there where you can find more details. I think the overarching message, though, that I just want to get across is even if you are identified as an authorised worker, we still want people to apply common sense around whether they need to leave the workplace to go to work. If you are an essential worker but you can work from home, you should work from home. There are obviously reasons why people need to leave the house, and we accept that. If you need to leave the house, you need to wear a mask. But really, again, as much as possible, we want to encourage people not to leave the workplace, not to leave their home for the workplace as much as possible, because as I said, that is where we are starting to see spread as well of the virus. If I jump across now to some of the restrictions, and I know this is probably the bit that is getting the most attention of trying to work through the rules around the LGA, and you can see that we've called out some of those questions on the screen there as well. Sorry, just make sure I'm on the right page. So again, I won't talk to the restrictions that are up there on the screen, and again, the link is there for people to get it. I will try to get that information. I will try just to address some of those questions. So certainly around medical appointments and attending medical practices outside of the LGA. For essential care, yes, absolutely, that is permissible. I think, talking on behalf of the local health district, we are looking at what we are doing at the moment that maybe isn't necessarily essential and could be deferred, and looking at potentially delaying some of that care because we do want to limit movement. But if you have got medical appointments and you need to move outside the LGA, that is appropriate. For pretty much everything else, I guess the message that I would be sending is, we would like people to stay within the LGA as much as possible. There's a theme there around, can I go outside the LGA if it's within the 5 kilometre radius? And the answer is technically yes, you can, but certainly the preference would be for people to remain within the LGA as much as possible and to avoid moving outside the LGA. If you don't have any other option and your local shopping centre is within 5 kilometres and it's outside the LGA, that is permissible. But as I said, the preference would be for people to remain within the LGA. And again, it should only be if you're leaving the house for essential purposes. And if it's related to shopping, it should only be one individual from each household that's going outside of that, outside of the LGA. There's no restrictions around deliveries. They can come into the LGA. There's no restrictions around people moving into the LGA as well for workers, although once you are within the LGA, there's an expectation that you're wearing masks at all times. Again, there's other reasonable excuses for people to leave the LGA that are listed on the screen there. Again, many of these, the themes are fairly similar to what I've covered before. We would prefer people did not leave the LGA. So for exercise purposes, we would prefer that people remain within the LGA. If for whatever reason that is not possible within the LGA, yes, you can travel within that 5 kilometre radius, but we would expect as much as possible people to remain within the LGA. For a specific question there around legal reasons, as is called out, to undertake legal obligations is one justifiable reasons for people to leave their household. Next one. So in terms of visitors, so obviously visitors is quite a restricted group. We, as I said at the start, what we are seeing with the way the Delta virus is spreading compared to maybe previous COVID viruses that have been, or previous versions of the COVID virus that have spread around, it is much more contagious within households than what we have seen previously. So people visiting other people's households is a real way where we're seeing this virus continuing to spread. So we really do want people to limit visiting other residents as much as possible. So there are reasons why you can do it, but again, I want people to apply as much common sense as they can and look at how much they can potentially avoid this as possible, because generally what we're seeing is if one person in the household has got COVID, then generally most people come down with COVID within that household, even before we necessarily have everybody tested. So it is quite serious how this is playing out at the moment. Specifically around the social bubble is also subject to the same limitations as everything else. So if you would like to, or the singles bubble as I think it's been referred to, if you would like to interact within the singles bubble, that is also within a 5 kilometre radius, or preferably within the LGA, acknowledging that that's probably one of those things that maybe doesn't change in the space of the last week or so. I think the rest again is on the screen, and might keep moving forward, and I'll just see if anyone's got anything coming through. So for those that are outside, visiting areas outside the area of concern, so for those outside the LGAs, there are still limitations on movement. There's still an expectation that people remain at home. There's an expectation that people only leave house for essential reasons. There's slightly different restrictions on movement, but at the end of the day, the principles are fundamentally the same. We want as many people as possible to remain in their home, to only leave their house for essential work, or one individual from each household for shopping, and really try and limit that movement. Obviously, for those that the movement outside Greater Sydney is heavily restricted. I don't know if Paul might pick that up a little bit later with what he has to say specifically around that. But just to reinforce that outside of the LGAs that are currently named, there is still significant limitations around that. If I move along to face masks, as I said, this has been tightened recently, so it's an expectation that for those in the 8 LGAs that they're wearing a face mask at all times when they leave their home, with some exceptions, which are namely really around exercise, and where it may, and if there's a medical reason not to wear it. So again, as much as possible, people should be wearing face masks when they are moving around the community. There's questions there specifically around exercising and strenuous exercise. Obviously, that would be one where there would be an exception around that. But again, you should be carrying a face mask with you, and if you stop, you should be putting the face mask on. Again, dog walking, it could go a little bit either way. But again, I guess what we're asking for is if people can wear a mask, they should be wearing a mask. If you're on your private property, that obviously is your space, and that doesn't necessarily need to have a face mask in that situation. Outdoor gatherings. So outdoor gatherings are limited to just the 2 people, and again, there's some exemptions around that that do come into that. So I think some of the questions that have been coming in, there are restrictions around the funerals and the weddings. I think that we do pick that up. No, we don't pick that one up. There's a link there around those numbers. Those numbers are slightly greater than 2, but not much. I think they're 10 from memory off the top of my head at the moment. And I get the question specifically around gardening and in the community gardens and private areas still permitted. It wouldn't be something that would normally fall within the the realms of what is permitted. And again, this comes back to the principle of we just want to try and avoid people moving around the community as much as possible. So certainly it needs to be considered as to whether that is essential that that occurs. But certainly my advice would be that that should be something that's avoided at this stage. And then the last one that I've got around the restrictions is around construction sites. So the construction sites will recommence in areas outside the 8 affected LGAs as of tomorrow, only if there's a approved COVID plan. So we won't see that is commencing everywhere, but they're certainly working with, I know Health is working with a number of construction bodies to put those in place. So I think for Georges River, there will be a further delay and we'll have to wait for advice to come from the Premier of New South Wales Health around when that actually does occur. There is obviously exemptions to that around ensuring that the construction site remains safe. So there's some questions there around scaffolding being able to come down. I think that would come into whether that's a security risk specifically for that site, and I guess that would need to be assessed on a case-by-case basis around that one. As I flagged, there's a number of testing locations that exist within the LGA at the moment. So we've got 7 combination of public and private sites that are available. We're also looking at an additional site being set up from next week. We continue to assess where we do need to have testing clinics, and if we don't think we've got enough coverage, we set up more clinics. So the link that is available there at the bottom gives you an up-to-date link of where all the clinics are within the LGA. Specifically though, I do want to flag out that all of these clinics have got good capacity. We're not seeing significant lines at the moment for anybody to get testing, and as I said, the turnaround time on your test results is generally 24 hours. The need to quarantine for that period is limited. For this LGA at this stage, there is no requirement for routine testing if you are an essential worker that's leaving the LGA. So it is only testing if you're symptomatic, but please, if you have got the slightest symptoms, please come forward and get tested, because the quicker we can catch the virus and make sure that people are isolating appropriately, the better. And as I flagged, there's a number of vaccination options that are available out there. I would strongly encourage people to consider taking AstraZeneca. Personally, I'm in my 40s. I had AstraZeneca when it was available, as soon as it was available for me several months ago. I didn't have any hesitation. So personally, I can attest that when as a medical person, when I assess the risk of having AstraZeneca versus the risk of getting COVID, the risk is significantly less to have AstraZeneca, and I would strongly encourage people to have that vaccination at the moment while it is available. Waiting three months or so until we see a good flow of Pfizer may be too late in some circumstances. So please, you don't want to mess with this virus. And the last slide is around financial support, which is available, and more information can be found through those websites. Not really my area of expertise, but please go and have a look at those websites. And I know very strongly that financial support is there designed to support people so that they can maintain isolation, maintain in their houses, and not necessarily have to go out for work unless it is absolutely essential. So please use those resources. Thank you, Mayor. You might be on mute.
Yep, no, I am. Thank you very much, Toby. I now ask Inspector Paul Callahan, Chief Inspector Paul Callahan, to give the correct title. Paul, if you'd like to make a contribution, that'd be appreciated. Thank you.
Yeah, thank you, Mayor. Thank you, Toby, and importantly, good morning to the Georges River community. As you know, the LGA was declared an LGA to obviously be subject to additional health orders and restrictions imposed due to the concerns about actual and potential transmission rates of COVID in the community. I can't highlight the importance of both the Mayor and also Toby's comments in relation to what we must do together. And I want to highlight that point that we as your local police are working alongside the Mayor and Council, New South Wales Health, Transport for New South Wales, and every other agency that we believe may assist this community and to provide those effective services. I know, and it's obvious that, you know, these times are challenging for everyone. And I want to be clear that, you know, we are all, police included, here to help and support you. We will not let you wonder or be confused about anything. But it's very important that everyone complies with these restrictions. These restrictions and public health orders were introduced to the health of the community as the objective, nothing else. The community is number one in our view, and I can assure you of that. From an enforcement point of view, overall, the community have been excellent in adhering to the orders, and I thank everyone for that. There have, unfortunately, been those that have not adhered to the restrictions and orders, and that puts other people's health at risk. You will see daily that not only the Premier and also the Commissioner talks about those that have been infringed for breaching the health orders. This is a situation that we ask that everyone works together. Therefore, police in our community are going to continue to enforce those health orders and restrictions, and that's to protect everyone. You will see more police in and around the Georges River LGA, and they're tasked to ensure your safety. I think it's important, and I know I'm regurgitating some points, but I just want to say them again because they are that important. And the Georges River LGA from today must adhere to face coverings. You must wear a fitted face covering outdoors all the time. There are exemptions, but generally, if you step foot outside your front door, you must wear a mask. You'll see that the Premier reported yesterday and the Commissioner that the fine has increased from $200 to $500. If you live in the Georges River LGA, you must not leave the Georges River LGA unless you are exempt. We understand that there are 37 sectors which are exempt. If you're not, please stay at home. Don't go out unless you honestly need to. That distance restriction of 5 kilometres, you cannot go any more than 5 kilometres from your home generally for any reason. And if you are an adult, you must carry evidence of your name and address to provide it to police on request. Further, you will hear that yesterday police had more powers to close any public place, construction site or business if you're doing the wrong thing, and that is a risk to public health. These powers and restrictions are a true reflection of how concerning the current health risk is to everyone, the community, the police, absolutely everyone. It's very important that we follow this. We want to work with you. We will get through this. I give you that undertaking, and we will do this together. We're here to help, and I can hand on heart when we regularly touch base with the Mayor and all the other agencies, we are working together to ensure your safety. I just simply ask that everyone respects each other and abides by those restrictions. I do see a question, how can people report? We are directing most of our reporting through Crime Stoppers, 1800 333 000, or you can report it online to Crime Stoppers, and importantly, that can be anonymous. So if there are people breaching those rules and you want to report that and you don't want to leave your name, that's fine. I can guarantee you we still receive it. There are vehicles dedicated within our command for COVID compliance, and again, that's to ensure that safety. We're always here for you, Cogra, Hurstville, Riverwood police stations, you know the numbers, anytime you ring us. So look, that's all I have at this stage, Mayor. Thank you for the opportunity.
Thank you very much, Paul. Now, we've got a couple of minutes. Toby, you've been getting your staff to follow some of the questions that have been coming up on the chat. We've tried to, as quickly as possible, bulk those into a couple of key themes. Would you like to, just in the few minutes we've got left, address a couple of those for us, please?
Yeah, absolutely, Mayor, and there's plenty of questions, so I'll do my best to try and pick out some of the key themes that have come through. There seems to be a lot of questions related to childcare and visiting homes related to childcare. So yes, childcare is one of those, one of the reasons why it's appropriate to visit a home or to leave the home potentially. I would just reinforce my comments, though, that I made, and I've got 2 young boys myself that are homeschooling at the moment, and it's incredibly difficult to deal with. So I empathise with everyone in this situation, but we are seeing significant spread within households. And so I think people do need to really consider the risk around grandparents providing care within the household at the moment, given that that is a group that we do see that have been more affected by this virus. And I would encourage, certainly if you are going to do that, encourage people to get the vaccination before they do that, but certainly people can visit the house if that is essential for that to occur. There's a question here around border travel to Queensland. The advice is on each of the states' websites about the ability to get into the other states to do it. In terms of leaving the LGA to do it, I think there is compassionate reasons around that, but I would make sure you check what your requirements are on the other end before you do anything. The Premier announced today that New South Wales Health is setting up a vaccination clinic out at Cunos Arena to provide vaccine for Year 12 students. So that will be available for those that want to access it. You can leave home for education purposes if it cannot be done remotely. That is another essential reason why people can leave home. And a couple of comments have come through about the number of hotspots and why Georges River has been identified when it doesn't have anywhere near the number of hotspots as the LGAs, other LGAs. If I can just explain how hotspots work. So the reason Georges River has been identified is because of the number of cases and the amount of spread that's occurring in the community. That doesn't necessarily correlate to the hotspots. If we believe, if the public health unit that looks after Georges River that works under me believes that they've captured all the people that were in a premises when there was a potential exposure, they won't necessarily identify that as a hotspot. Similarly, as I said, we're seeing a lot of spread actually within households and possibly within some workplaces, but not necessarily workplaces within Georges River. So you won't see a correlation between hotspots and the LGAs that are called out. It really does come down to the number of cases and the ability and the belief that we have of whether we've got on top of that or whether we think that the cases are spreading across the community. So hopefully that addresses that specific issue. As I said, there were lots and lots of questions. I hope I've covered most of them. And I know there's a number of comments, and I know that this has been recorded and will be available after, so people can look at previous answers to hopefully address that.
Thank you very much, Toby. And that is a good segue to what will be the conclusion of this. As you know, we've got a 1:30 deadline. First thing I'd like to do is thank Toby and Paul for their contributions this afternoon and in answering the questions. I'd also like to remind everyone, as Toby's just indicated there, this webinar will be available on our website as much as anything so as you could hear the comments that were made, but also so that some of those briefing notes that were provided on the screen, you'll be able to see each of those. There were also various links provided as part of those presentations, which may also assist. We'll also be endeavouring on our website this afternoon to compile all the questions that have come through via the chat room or any questions that have been put up, and we'll be looking to get answers to those either individually or in groups. We'll be looking to have those up on the website as well to try and address everyone's concerns. As a community, Georges River recognises that we need to get on top of this as quickly as possible. I think it's been shown today that as a group, we're certainly very keen to work with the Department of Health and the police, and indeed all the emergency services, those who are doing so much on our behalf. We particularly appreciate, as I say, the police and all the health professionals who are involved in this, but also those who have other caring roles in our community. It's tough times for everybody, but we need to keep working together, supporting each other, and from a council's perspective, we'll be doing our best to get the information out. Hopefully, early next week, we'll have a vaccination centre set up within our local community. As you know, we're working with the Department of Health on that. As soon as that happens, we'll be getting that advice out to the community because, as I say, we want to get on top of this. We need to get people vaccinated. We need to get people tested. And if we can do those two things, we'll get over this a lot quicker. And as I say, we'll come through it. And we sincerely hope that the numbers of people suffering will decrease very quickly. And most definitely, we do not want to see people hospitalised, and certainly we don't want to see people losing their lives to this insidious disease. With that, I'll conclude the presentation. And again, thank you, everyone. And most importantly, please stay safe, stay well. Thank you very much.